Hi, I'm Dr. Ritika Goyal and I'm a pediatric chest specialist in New Delhi. Today we are going to discuss about a very common problem in the city and that is nasal allergies. Nasal allergies is also known as allergic rhinitis. Allergic rhinitis is very common amongst the pediatric population as well. So what happens in nasal allergies? In nasal allergies, children often complain of excessive mucus production because of which they always have a runny nose or they have a blocked nose. They have paroxysms of sneezing, that is, they sneeze almost 7 to 8 times, maybe 10 times in a row, especially in the morning. And they often have a nasal itch because of which they keep rubbing their nose like this or like this. And because of that, because of this repeated itching of the nose, they often have a straight line, crease developing over here. These are the common symptoms of nasal allergies. Many times, children with nasal allergies who have excessive mucus production, the mucus keeps dripping into the throat and causes throat irritation, because of which they also complain of cough. Children with allergic rhinitis have very specific pointers on the face that develop over a period of time. As I already mentioned, because of constant itching of the nose, they develop a crease called the nasal crease on the tip, on this part of the nose. Some children have small bags forming under their eyes and they can have bluish discoloration just below the eyes near the nose. These are called allergic shiners. These are some of the pointers towards nasal allergies that have not been addressed over a long period of time. Sometimes, when the nasal allergies have been prolonged and have not been addressed, these children have concomitant sinusitis. What happens in sinusitis is that the maxillary sinuses that are present over here on the cheeks, they get filled with mucus. And as a result, there is a constant feeling of heaviness, maybe some headaches, especially in this area. And these children often have a wet, productive cough with thick yellow mucus. Some children with sinusitis can also have mild fever. Children with allergic rhinitis often have sleep related issues or breathing issues during sleep. And this is because they often have adenoid hypertrophy. Adenoid hypertrophy means there is a soft tissue behind the nose which swells up because of chronic inflammation. And because that tissue swells up, it blocks the upper airway. And this blockage is more pronounced when the child is sleeping. This is the reason children with adenoid hypertrophy often have mouth breathing and they're not able to sleep properly at night and feel very tired and lethargic in school during the day hours. The most important treatment of allergic rhinitis is the use of intranasal corticosteroid sprays. Intranasal steroid sprays are the mainstay of treatment as they work on all the problems that are there in allergic rhinitis with equal efficacy. They reduce the mucus production, so they work on runny nose. They help in relieving nasal blockage. They reduce sneezing and they also reduce the nasal itch. It is because of these four symptoms that all the complications of nasal allergies arise. And it is seen that almost 70 to 80% of children who take these steroids for the desired amount of time do well, their allergies get better, their adenoid hypertrophy gets released, their symptoms because of adenoids get relieved, and in general, they do much better. Sometimes in children who don't do well on intranasal steroid sprays, we do have combination of intranasal steroid and antihistamine sprays, where along with the corticosteroid, one anti-allergy medicine is also added in the nasal spray. The main benefit of these nasal sprays is that they are locally acting. They act in the nasal cavity where they're supposed to act. Their systemic absorption, that is, the amount of medicine that goes in the blood, is almost negligible. So, when the medicine is not going in the blood, it definitely is safer. The second treatment for allergic rhinitis is use of oral antihistamines. Sometimes in children who have severe symptoms or who are not responding well, do require oral antihistamines like levocetrizine or cetrizine or fexofenadine. And these medications are given at a very low dose over a long period of time to achieve the desired results. Another form of treatment that really helps is nasal douches or saline washes. In children who are old enough to do it, we prescribe some nasal sprays that are just plain saline sprays. This helps in washing out the nasal secretions that are accumulated in the nasal cavity. This definitely reduces the allergen load in the nasal cavity as well, and children do feel a relief in their symptoms. Sometimes we get children who do not respond well to these medications. In these children, allergy testing plays a very important role. When we have a child who's not responding to treatment, we do an allergy test, which is the skin prick test, and we try to find out what the child is allergic to. In case we find an allergen for which we can offer immunotherapy, then allergen immunotherapy is now a very good option for children with nasal allergies. In all the international guidelines laid out by the European and American societies, now sublingual and subcutaneous immunotherapy can be given for children with allergic rhinitis who have sensitization to house dust mites. So, if your child has nasal allergies, persistent nasal symptoms, or sleep related issues, if your child is snoring at night, or is very tired and sleepy during the day, if your child has repeated recurrent cough with or without any expectoration, with or without mucus, these are some of the pointers where you must consult a pediatric pulmonologist to figure out whether your child has any allergic rhinitis or nasal allergies going on and get the proper treatment.